Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
And good morning. I'm Dr. Kim Allen Williams, chair of medicine here at University of Louisville, and welcome to a Cardinal Minute. We have had the distinct pleasure this morning of having a fantastic symposium as a grand rounds from our speaker, Dr. Alan Brown, who was a past president of the National Lipid Association, and he gave us an intriguing insight into the future of lipidology and new therapies for dyslipidemia. Dr. Brown, can you give us a 1-minute summary of your talk?
Probably not. We covered a lot of things, but I think the summary would be that we've got some really exciting new approaches to treatment of diseases that affect lipids, which likely will translate into reduced cardiovascular outcomes, but also just as importantly in folks with rare lipid disorders that have a lot of morbidity, such as severe hypertriglyceridemic patients who have recurrent pancreatitis. We now have some options that will actually help those patients when traditional therapy has not. So that's exciting. And then also the onset of the use of oligonucleotide therapy, which allows us to target almost any protein, not only in the lipid field, but probably in many other fields. And the evidence that they're safe and effective is very exciting. And then finally, we talked about some newer trials that might affect guidelines, including the Vesalius trial, which was a trial of patients who have not yet had a coronary or cerebrovascular event, but have evidence of atherosclerosis or have high-risk diabetes. And those patients got significant benefit of PCSK9 inhibitors. And that should hopefully change the guidelines, which currently say it's for people who've had a major cardiac event, plus some other modifying risk factors based on the study designed for FOURIER and Odyssey outcomes. So Vesalius expands the benefit of PCSK9 antibodies in patients who have atherosclerosis subclinically, but who may not yet have had an event.
Well, it's really amazing. It was a wonderful journey. Great to hear the history and where we're going in the future. I want to thank you for the presentation, but also for your long career of mentorship and education of so many of us in the area of lipidology and in general cardiology. Thank you so much for all that you've done. And this has been a Cardinal Minute.